I'd like to call to order this special meeting of the Cunningham Township Board for Monday, August 1st, 2022. Will the clerk please call the roll?
Ms. Wu.
Here.
Mr. Evans.
Here.
Ms. Hersey.
Here.
Ms. Colasetti.
Here.
Ms. Bishop.
Here.
Ms. Wilkin.
Here.
Mr. Quisenberry.
Here.
Mayor Marlin.
Here. Are there any additions to the agenda? I don't believe there are any. Public participation. Does anyone wish to address the Cunningham Town Board? Please state your name for the record.
All right, Alan Max Axelrod. I'm a resident of Urbana, Ward 3. Before you are two questions that are advisory referenda on the ballot regarding Medicare for All and the Support for Workforce Training Program.
Could I interrupt you for just a minute? Could you start the timer, please?
Oh, yeah, okay, I'm
Thank
sorry.
you. Thank you.
Likewise, I realize that's been a problem before, so I want to be very clear about the Support for Workforce Training Program advisory question. It is not an attack. It is meant to say very clearly what the residents that the trustees who are elected by a community represent believe should be done with that program. Because when you're looking at, for example, the pandemic situation, since March 14th, we haven't been reporting deaths on the weekends. The Illinois Department of Health has not been reporting deaths on the weekends. They resumed that this week, just as a emergency declaration regarding monkeypox was released by the state government. You might think that this program is already at a sufficient level of capacity, full enrollment. That's not the point of that question. The point of that question is to provide an investment using the American Rescue Plan money into our community to increase the amount of benefit brought in. And when you read these reports about CNAs, these are certified nurses who are leaving the profession due to the work conditions, the chronic stress, and the fact that we are not out of this pandemic. Again, the July 2022 7-day average death rate was higher than the July 2021 death rate nationwide. In order to say that the pandemic's receding, you have to show some data for that, and it has to be in terms of deaths because everybody stopped talking about cases. On the note of cases, we've had less than 100 days below 2,000 cases a day in terms of our 7-day average since July, mid-July of last year, if I'm not mistaken. Less than 100 days. This is not a seasonal thing, it's public health. And regarding the SWIFT program, just as the Public Health Department mentioned that racism is a public health issue, this is meant to provide equity at an expedited rate to residents who have been left behind. That's literally what the Workforce Equity Initiative, the parent program for SWIFT, says on their website. So that is all that is meant by that question. We're not looking to attack any politicians who are responsible for the administration of that program. People are operating well within the parameters that they have, and they have their other priorities. That's fine. This is our priority, and we want to see whether or not the community agrees. Thank you.
Thank you. Does anyone else wish to address the Cunningham Town Board? Okay, we'll move on to the item of new business, which is Resolution T-2022-08-013R, a resolution certifying two questions adopted at the 2022 annual town meeting for the November 8th, 2022 election. Ms. Clark, did you want to add anything?
No, I don't want to add anything at this point. I will answer any questions if anyone have one.
Okay. And I think for the record, we'll read these two advisory questions. The first is, shall Parkland Community College increase the enrollment for the support of the workforce training program, as well as increase the stipend of all those enrolled in that program through an intergovernmental agreement with local governments? And then the second advisory question that you're voting on is, shall the federal government create a universal national health care system of improved Medicare for all to ensure that all of the residents of the United States receive quality health care that is equitable and fair from birth to death? Can I have a motion, please?
I'll move certification of those 2 questions for the ballot.
I'll second.
Discussion. Sharice?
I guess one of my first questions is, as a local government, do we have any say over what the federal government does?
What
Ms. Clark.
happens here with the township is something that is set by the township officials of Illinois. And it is something that deals specifically with the electors. That's any person that attends the annual town meeting at that time. If they bring, such as this question, it was filed in time with our office, and it was presented at the annual town meeting. The electors heard it, they voted for it, and it is by law to go on the ballot for the November election. What your role is, according to the township officials of Illinois, is that you shall pass this resolution so these questions can be done, because the powers belong to the electors, not the board.
Okay.
And again, these are advisory
Advisory,
referendum
yes.
expressing the opinions of the electorate. Any other comments? Chris?
Yeah, I'm kind of aiming this at the activists, because since last year, in June of 2021, I believe the mayor and the city administrator visited the SWIFT program. Back then, they were told they're doing fine, they don't need any more money. Again, today, the staff of the SWIFT emailed the council and said they don't need any money. So I just want to put that out there. I think, it's okay that the city or this is put on a referendum to be voted on. That's fine. But I think there needs to be some communication between the activists and those that run the SWIFT program, because you both are, neither one of you are on the same page.
Well, again, just to
Yeah.
remind folks, the item before you is to vote to place these on the ballot for the November election. Any other comments? James?
Is my recollection wrong? Are the electors able to put up 3 questions or only 2?
If they have certified with the clerk's office prior to the date that the questions have to be given to me, and we get them
Okay.
ready, then they can put as many questions on there as they vote for.
Oh, okay. So it's not limited, it's just
No.
how many they choose.
Yes.
All right, thank you.
Okay. Will the clerk please call the roll?
Ms. Wu?
Yes.
Mr. Evans?
Yes.
Ms. Hersey?
Yes.
Ms. Colacetti?
Yes.
Ms. Bishop?
Yes.
Ms. Wilkin?
Yes.
Mr. Quisenberry?
Yes.
That motion passes. And with no further business before the Cunningham Town Board, this meeting is adjourned.